In this podcast episode, Dr. Matthew Walker, a renowned sleep scientist, delves into the intricate world of sleep, exploring its significance, the science behind it, and practical insights for achieving better sleep. The conversation covers a wide range of topics, each shedding light on different aspects of sleep and its impact on our lives. Dr. Walker emphasizes the critical role sleep plays in our overall health and well-being. He explains that sleep is not merely a passive state of rest, but an active process that is essential for various bodily functions. Sleep is crucial for cognitive processes, emotional regulation, and physical health. It is during sleep that our bodies repair and rejuvenate, and our brains consolidate memories and process information. The lack of adequate sleep can lead to a myriad of health issues, including obesity, diabetes, cardiovascular diseases, and even a shortened lifespan. Moreover, Dr. Walker highlights the societal misconceptions surrounding sleep, particularly the glorification of sleep deprivation. Many people wear their lack of sleep as a badge of honor, believing that sacrificing sleep is a necessary trade-off for productivity. However, Dr. Walker argues that this mindset is detrimental as it undermines the fundamental importance of sleep for optimal functioning. He urges listeners to prioritize sleep as a vital component of a healthy lifestyle, rather than viewing it as a luxury. The conversation transitions into defining what constitutes good sleep. Dr. Walker introduces the four key components of sleep: quantity, quality, regularity, and timing, collectively referred to as the QQRT model. Quantity refers to the total hours of sleep one gets, with the recommended range for adults being between 7 to 9 hours. However, Dr. Walker stresses that simply being in bed for that duration does not guarantee quality sleep. Sleep efficiency, which measures the percentage of time spent asleep while in bed, is equally important. Quality of sleep is another critical factor, encompassing the depth and restorative nature of sleep. Dr. Walker explains that good quality sleep involves sufficient amounts of deep non-REM sleep and REM sleep. Regularity, or maintaining a consistent sleep schedule, is vital for regulating the body's internal clock. Finally, timing refers to the alignment of sleep patterns with natural circadian rhythms. Dr. Walker emphasizes that understanding and optimizing these components can significantly enhance sleep quality and overall health. Dr. Walker discusses the profound effects of sleep deprivation on both physical and mental health. He explains that chronic sleep deprivation can lead to cognitive impairments, including difficulties with attention, memory, and decision-making. The brain's ability to process information and regulate emotions is compromised when it does not receive adequate rest. This can result in increased stress, anxiety, and mood disorders. Furthermore, Dr. Walker highlights the physiological consequences of sleep deprivation, such as hormonal imbalances and weakened immune function. He notes that sleep deprivation can lead to increased levels of cortisol, the stress hormone, which can have detrimental effects on overall health. The cumulative impact of insufficient sleep can create a vicious cycle where poor sleep leads to health issues, which in turn further disrupts sleep. Dr. Walker emphasizes the importance of recognizing the signs of sleep deprivation and taking proactive steps to prioritize sleep. The discussion shifts to the role of technology in monitoring sleep patterns. Dr. Walker acknowledges the growing popularity of sleep tracking devices and apps, which can provide valuable insights into sleep quality and duration. He explains that these tools can help individuals become more aware of their sleep habits and identify areas for improvement. However, he cautions against becoming overly reliant on technology, as it can sometimes lead to anxiety about sleep. Dr. Walker also discusses the limitations of sleep trackers, noting that while they can provide useful data, they may not always accurately reflect the complexities of sleep. He encourages listeners to use these tools as a guide rather than a definitive measure of sleep quality. Ultimately, the goal should be to cultivate a healthy relationship with sleep, focusing on the underlying principles of good sleep hygiene rather than fixating solely on numbers. Dr. Walker delves into the relationship between stress, anxiety, and sleep. He explains that high levels of stress can significantly disrupt sleep patterns, leading to difficulties falling asleep and staying asleep. The body's fight-or-flight response, triggered by stress, can keep individuals in a heightened state of arousal, making it challenging to relax and transition into sleep. To combat this, Dr. Walker suggests various strategies for managing stress and anxiety, such as mindfulness practices, meditation, and breathing exercises. He emphasizes the importance of creating a calming bedtime routine to signal to the body that it is time to wind down. By addressing the underlying causes of stress and anxiety, individuals can improve their sleep quality and overall well-being. The conversation takes an intriguing turn as Dr. Walker explores the science of dreaming. He explains that dreaming occurs primarily during REM sleep and serves several important functions. One of the key benefits of dreaming is its role in emotional processing. Dr. Walker describes how dreaming can help individuals work through difficult emotions and experiences, providing a form of overnight therapy. Additionally, Dr. Walker discusses the connection between dreaming and creativity. He explains that during REM sleep, the brain makes unique associations between seemingly unrelated memories, fostering creative problem-solving and innovative thinking. This highlights the importance of both REM sleep and dreaming in enhancing cognitive function and emotional resilience. Dr. Walker addresses the impact of common substances like caffeine and alcohol on sleep. He explains that caffeine, a widely consumed stimulant, can interfere with sleep quality and duration. The half-life of caffeine means that even if consumed earlier in the day, it can still affect sleep later on. Dr. Walker advises listeners to be mindful of their caffeine intake, particularly in the afternoon and evening, to ensure it does not disrupt their sleep. On the other hand, Dr. Walker discusses the misconception that alcohol can aid sleep. While alcohol may initially help individuals fall asleep faster, it ultimately disrupts sleep quality and leads to fragmented sleep. He emphasizes that alcohol can interfere with REM sleep, which is crucial for emotional processing and cognitive function. Dr. Walker encourages listeners to be aware of the effects of these substances on their sleep and to make informed choices. The conversation touches on various sleep disorders, including insomnia and sleep apnea. Dr. Walker explains that insomnia is characterized by difficulty falling asleep, staying asleep, or waking up too early. He emphasizes the importance of addressing the underlying causes of insomnia, which can range from stress and anxiety to medical conditions. Cognitive behavioral therapy for insomnia, CBTI, is one effective treatment option that focuses on changing negative thought patterns and behaviors related to sleep. Dr. Walker also discusses sleep apnea, a condition characterized by interrupted breathing during sleep. He highlights the importance of seeking medical evaluation for sleep apnea, as it can have serious health consequences if left untreated. Treatment options for sleep apnea may include lifestyle changes, continuous positive airway pressure, CPAP therapy, or dental devices. Dr. Walker encourages individuals experiencing sleep disturbances to consult with healthcare professionals for proper diagnosis and treatment. As the conversation progresses, Dr. Walker shares his insights on the future of sleep research. He expresses optimism about the growing awareness of the importance of sleep and the advancements in sleep science. Researchers are increasingly exploring the intricate mechanisms of sleep and its impact on various aspects of health, paving the way for new treatments and interventions. Dr. Walker also emphasizes the need for continued public education about sleep. He believes that by raising awareness of the significance of sleep and its effects on overall health, individuals can make informed choices and prioritize their sleep. The integration of sleep science into healthcare and wellness practices is essential for improving public health outcomes. Throughout the episode, Dr. Walker provides practical tips for improving sleep quality. He emphasizes the importance of establishing a consistent sleep schedule, creating a relaxing bedtime routine, and optimizing the sleep environment. Simple changes, such as reducing exposure to screens before bed and keeping the bedroom cool and dark, can significantly enhance sleep quality. Additionally, Dr. Walker encourages listeners to prioritize sleep as a non-negotiable aspect of their health. He advocates for viewing sleep as a vital component of overall well-being, rather than a luxury. By making sleep a priority and implementing healthy sleep habits, individuals can experience the numerous benefits of restorative sleep.